In the near future, I may actually be replaced by a robot. Yes, the kind that uses internal sensors and artificial intelligence to identify patient anatomy, coordinate autonomous movement, and perform surgery in the operating room. While this bone-chasing demonstration is extremely impressive, once properly anesthetized, the patients won't be able to move, or worse, escape. But for real, this is no joking matter. For on this channel, we are serious pursuers of knowledge. And today, we have a special guest to help facilitate that process. Interns, I'm proud to introduce MBOSS, the robot surgeon, and its creator, Monogram Orthopedics, a cutting-edge medical company revolutionizing the development of surgical robotics and joint replacement, as well as today's video sponsor.
So I'm at about 50% right now.
So you can see there's a cut path labeled 1. So that's going to be the first path that the robot goes on.
Whoa, whoa, whoa. We've got some stuff to cover before we're ready for a full-on demo. Now, in my opinion, Douglas Eunice, a board-certified attending orthopedic surgeon for the Mount Sinai Health System and Monogram founder, and his team are poised to take the knee replacement industry by storm. And when that happens, we'll all need to warm up to the idea of trusting this MBOSS with our life and our limbs. As such, today's class will explore the ways in which AI, augmented reality, and robotics have infiltrated medical practice. I will introduce you to the current technologies available in this field and explain how the Monogram team could out-leverage them with advanced engineering and innovative design. Keep in mind, Monogram, who will be listing on the NASDAQ in only a few weeks, is presently crowdfunding, and this is their last planned public offering before listing. So this is a fantastic opportunity to get in on the ground floor by going to www.monogramorthopedics.com to invest today. Be sure to stick around to the end of the video so that you learn why I'm so freaking excited by this technology. For my part, I'm thankful to have been connected with these guys, as this is literally where several of my main interests intersect: medicine, technology, and robotics. Back in school, I loved my computer programming and machine learning courses, and although I will be sad if and when I no longer have a place in the operating room, I am excited for the future of robotics and artificial intelligence in orthopedics. First, let's talk about AI.
Hasta la vista, baby.
The good kind, in case there was any doubt. Thanks to advancements in technology, we now have access to a range of powerful tools that can help us diagnose, treat, and manage diseases more efficiently than ever before. From wearable devices that monitor our health in real time to virtual assistants that can provide personalized medical advice. With the help of machine learning algorithms and natural language processing, we can now analyze vast amounts of medical data in a matter of seconds, making it possible to diagnose diseases earlier and with greater accuracy. AI is also being used to develop new treatments and therapies, with researchers using machine learning models to identify new drug targets and design more effective treatment plans. And with the rise of telemedicine, patients can now receive medical advice and treatment from the comfort of their own homes, thanks to AI-powered chatbots and virtual assistants. But let's not forget about augmented reality, which also boasts some incredible advancement in recent years.
Well, I guess this is my life now. I'm a professional surgeon that's been called in to save the life of a man by the name...
Now, you only need to own a virtual reality device to learn how challenging it is to be on call. But on a more serious note,
it is augmented reality, it is mixed reality. I still see you, I still see this room and everything around me, but the digital content is inserted into the room as if it's actually there.
That's Jeff, Director of Visualization for HoloLens at Microsoft, who is involved in the development of augmented reality technologies. As he mentioned, AR overlays computer-generated images onto the real world, creating an immersive and interactive experience. This has a myriad of applications in the medical field, helping us to improve patient outcomes and streamline procedures. Medical students can use augmented reality to practice surgical procedures in a safe, controlled environment, long before they ever have to attempt that surgery in a live patient, as seen here with Arch Virtual's custom reality system. Trained surgeons may use AR to visualize patient anatomy in 3D, allowing them to plan surgeries with greater precision and accuracy.
This highly realistic model, once loaded onto the viewing device, can be displayed in augmented reality,
which effectively enables us and any surgical robot, M-Boss, I'm looking at you, to measure thrice, cut once. But until I've been replaced by a robot, the most useful application of this technology for me is in the operating room.
This is our consent form for the procedure. As you know, the novel part about this procedure is we're going to be using a new augmented reality guided computer system that's mounted on a headset.
During surgery, AR can be used to overlay vital information such as patient vitals, imaging data, and surgical plans directly onto the surgeon's field of view, reducing the risk of error and improving outcomes. A welcome reality for Timothy Witham and his team at Johns Hopkins Medical Center. Finally, in patient care, AR is being used to enhance the patient experience, with hospitals using AR to create interactive experiences that help patients understand their own conditions and treatments. Overall, AR has the potential to revolutionize the way we approach medicine, improving patient outcomes and reducing medical errors. It's all very promising stuff. And now, equipped with a basic understanding of AI and AR in the current medical landscape, let's move on to robotics. In this rapidly advancing field, many exciting developments allow us to improve patient outcomes and streamline medical procedures. Thus far, robots have infiltrated the practice of physical therapy, as pictured by the Robiligent team, where they help patients recover from injuries and improve mobility, with robots providing targeted exercises and feedback. As well, the world of prosthetics, where they help create advanced prostheses that are more responsive than ever before, giving amputees greater independence and mobility. Just ask Johnny Matheny, whose arm was amputated due to an aggressive form of cancer, and now the first person to attach a mind-controlled prosthetic limb directly to his skeleton.
So in 2008, they amputated my arm just above the elbow. I got a second chance of life.
Robotics is even being used in medication management, with robots dispensing medications and monitoring patients' adherence to treatment plans. But as you already know, the list does not end there. Buckle up, interns. This is where it gets really interesting. As technology advances, it is becoming more and more common to see robotic tools in the operating room, where they can be used to perform complex and delicate procedures with greater precision and accuracy than human surgeons. You may recall this video which went viral 12 years ago when a surgeon used the Da Vinci surgical robot to delicately remove the skin of a grape. An early testament to robotic success, the Da Vinci robotic platform consists of 4 robotic arms located adjacent to the operating table and is controlled by a surgeon sitting in a nearby console. This unit integrated 3D vision, precise instrumentation, and motion control to allow the attending surgeon to
enable the Da Vinci surgeon to transcend the limitations of conventional surgical technologies.
Thanks, smooth-voiced infomercial guy. But this is only one of the forerunners that laid the foundation upon which today's video partners at Monogram and their M-Boss robot are able to stand so confidently. Here are some other robots actively practicing in hospitals today. If in the past 7 or so years you needed neurosurgery, you may have had the pleasure of meeting the Rosa robot.
We connect the patient's head to this Mayfield head holder. We connect that to the Rosas, to the robot, and then we also connect the head holder to the bed.
Here, Roy explains the device that keeps the patient's head steady as Rosa performs surgical procedures. This robot allows for great precision in targeting tumors or other brain abnormalities and can be adapted to perform orthopedic surgery, more on that in a moment, and assist in the implantation of prostheses. The Mako robotic arm system is another robot used for orthopedic surgery that allows surgeons to perform hip and knee replacements with greater accuracy and efficiency. The CyberKnife is a robotic platform used for radiosurgery, delivering high doses of radiation to tumors with extreme precision. And finally, the Stereotaxis robotic platform is used for cardiac procedures, allowing for precise control of catheter movements during during heart surgeries. With the help of these robotic platforms, surgeons can perform complex procedures with greater accuracy, efficiency, and improved outcomes for patients. The robotic devices that we've covered so far have found a home in hospitals all around the world, opening the door for the next generation of devices such as Monogram's MBOSS. Next, we'll take a look at some of the devices that have special application in the field of orthopedics and how Monogram has managed to set themselves apart from existing robotic devices in that field. Let's return for a moment to our discussion about the Mako robotic arm system and the ROSA brain robot, as these two robotic platforms have had a significant impact on the field of orthopedic surgery. The Mako system uses a combination of CT scans and real-time 3D modeling to create a digital representation of the patient's joint.
The implant's on specifically on the end of the bone, 3D in space prior to even coming to the OR room or the operating room.
This allows for greater accuracy and precision during joint replacement surgeries.
Boo! Boo! My sister can attach ventricles better than you.
As the surgeon can create a customized surgical plan that is tailored to the patient's unique anatomy. Then, as you see here, the pre-surgical plan is mapped to the patient's anatomy intraoperatively and allows for intraoperative adjustments by the operating surgeon.
And then we come in with the robotic arm and make these cuts, but it will only allow me to be locked into a haptic where it will not allow me to cut beyond the bony edges.
Haptic guidance, which provides real-time feedback to the surgeon through the robotic arm, is used to guide the cutting tools in making precise cuts during surgery. In other words, the robot guides the surgeon's hand during the procedure, helping to ensure that the implant is placed in the correct position and orientation. Haptic field constraints ensure that the robotic arm only allows removal of bone within 0.5 millimeters of the original surgical plan. Studies have shown that the use of the Mako system results in better alignment and positioning of the joint implant when compared against conventional implant placement. In a way, Mako's robotic arm anticipates Monogram's MBOSS, which removes the need for a surgeon to operate the arm once surgery is underway, improving the margin of error even further.
What you're seeing here is the robot demonstrating its ability to maneuver in very unique ways and twist and reach cavities that can be difficult to reach.
You may be able to appreciate this clip from Monogram's recent product demonstration on an example knee even more now.
This is kind of like a GPS. It's very similar, so it's intuitive. Like I can see the routes that the saw is going to take.
Yep.
I can see the current route that it's on. I can see where the blade is.
Yeah.
Monogram refers to the pre-mapped routes that guide the MBOSS robot as robot rails, which yield extremely precise cuts. Very freaking impressive. Now, let's circle back around and consider ROSA's applications in orthopedic surgery.
I use it on all knees that I replace because I feel like it helps me do the knee more perfectly.
Christopher Palmer, whose voice we heard in that clip, is just one of many orthopedic surgeons who have begun to incorporate robotics into their practice. ROSA is used to provide greater accuracy and precision during total joint arthroplasty procedures. The robot uses a combination of imaging data and real-time feedback to help the surgeon navigate to the precise location of pre-planned cuts. The ROSA system uses a stereotactic cutting jig to guide the surgeon's tools, which is placed on the patient's femur or tibia as pictured here. With this system, the surgeon uses a saw to make cuts through the cutting jig. In some cases, the robot can also be used to guide surgical instrumentation during the procedure. The use of the ROSA robot has been shown to improve the accuracy of implant placement during arthroplasty procedures. However, with both the Mako and ROSA robotic systems, their ability to make sagittal cuts is limited by their design and technology. A sagittal cut is a cut that divides the body or a body part into left and right sections. The Mako system is primarily designed for making cuts in the transverse plane, horizontal, or the coronal plane, vertical, which limits its ability to make sagittal cuts. This is because the robotic arm is not designed to rotate around the patient's limb axis, which is necessary for making sagittal cuts. Likewise, the ROSA robot's ability to make sagittal cuts is also limited. While its frame can be rotated in the transverse and coronal planes, it is not designed to rotate around the sagittal plane, limiting the robot's ability to make sagittal cuts. Surgeons must be aware of these limitations and use the appropriate tools and techniques to make sagittal cuts as necessary. Fortunately, Monogram has taken this into account in their design. enabling MBOSS to move in the transverse, coronal, and sagittal planes to attain the perfect angle at every phase of the surgical procedure.
Technology like this could not only upset the surgical realm by having a better value stream there, but it could also upset the manufacturing realm. It has the potential to replace existing technologies.
The advantage of using the Monogram robot over the Mako or ROSA robots for joint replacement surgery lies in its use of high accuracy surgical robotics, including the navigated active sagittal cutting robot arm, which is believed to be one of the first of its kind on the market. Monogram will be the first navigated robot to actively cut with a sagittal saw. So what does this mean? It means that they can do things like this incredible remote surgery. Typically, it is extremely difficult to actively cut with a sagittal saw. With Mako, the surgeon is figuring out the cut paths, but with Monogram, the software has to figure it out. By using this advanced technology, Monogram aims to improve the accuracy and precision of joint replacement surgeries, thereby reducing the incidence of surgical error or failures of fixation. This in turn will reduce the risk of complications and the need for revision surgery.
The little robot's hands have such amazing range of motion. It's better than our human hands.
The Monogram robot is different from other surgical robots, such as the Mako or ROSA systems, in several more ways. Firstly, the Monogram robot is specifically designed for joint replacement surgery, whereas the aforementioned systems are designed for a number of surgical specialties, including orthopedic and neurosurgery, respectively. By specializing in joints, the Monogram team has had the opportunity to research and refine the biocompatible materials used in the actual replacement process.
What we're developing is a next generation 3D printed implant that is optimized for press fit fixation and insertion with a state-of-the-art orthopedic robot.
Monogram offers customized patient-specific implants that are 3D printed in accordance with the patient's anatomy and the specified surgical plan. Everything begins with the CT scan of the patient, but I'll let Ben Sexton, Monogram CEO, explain further.
And that CT scan is used to generate a patient-optimized implant that is designed for more stability, but is less invasive.
As much as it pains me to say, it would seem that generic implants and the surgeons who install them are operating on borrowed time. ROSA is an imageless system, and it is likely that the entire market is going to move not only to personalized implants, but also personalized surgery, with implants that are functional or aligned kinematically. If this is the case, it will be very difficult for imageless systems like ROSA and all other robots other than Mako to adjust, because you really need CT imaging to do personalized alignment. I really freaking love my job, but more than that, I love to see my patients make a full recovery. And if a robot surgeon armed with custom printed implants can guarantee a better outcome, I will graciously step aside.
The future of orthopedic medicine is highly personal. It's about delivering patient-specific solutions that are perfectly fit and perfectly inserted.
Monogram's one-of-a-kind implants are specifically designed for you, and only you.
How many implants do you have total?
I think I have 25 implants now.
And they plan to do this in a low-cost manner so that these custom implants can be accessible to everyone who might require a joint replacement. Not only are their implants patient-specific, but their unique combination of individual components also allows for press-fit fixation to the patient's bone so that they can be secured without cement, giving it an advantage over current practice. According to the NIH, polymethyl methacrylate, PMMA, is commonly known as bone cement and is widely used for implant fixation in various orthopedic and trauma surgeries. Although really, PMMA acts as a space filler that creates a tight space which holds the implant against the bone, and thus it acts more as a grout. Cement is used in over 92% of knee implants used to date.
There are a lot of things you can use when you know how to use concrete.
Because Monogram will use 3D printing to produce their personalized implants, they will be able to create implants that are customized to the bony anatomy and cavities present in each patient, which will provide a better fit, better function, less pain, less complications, and all at a better price to boot. No more one-size-fits-all implants or an implantation process that has not changed for the past 40 years. Secondly, Monogram combines state-of-the-art augmented reality with high accuracy surgical robotics and sagittal cutting to achieve an active system, which means the robot operates autonomously under surgical supervision without real-time guidance. Skynet. You can see here, the robot already detects the movement of the leg, mirroring real-world movement of the leg in the adjacent viewing window. Then, by depressing the foot pedal, the surgeon affects the speed at which the emboss carries out its predetermined plan. Via this remote pedal, Monogram is designed to integrate with the surgeon's natural movements, providing real-time feedback and assistance to enhance surgical precision. This integration is achieved through the use of advanced sensor and software algorithms that allow the Monogram robot to respond to the surgeon's movements and adjust its own movements accordingly. Unlike its predecessors, this process does not require any cutting jigs, since the operative plan is based on the 3D reconstruction, and therefore less operative trays are required in the operating room, making setup faster and easier for operating room staff. A 2021 article in eFort Open Reviews sums it up nicely. The robotic software is used to configure the surgical plan offline based on the preoperative CT imaging. The surgeon then performs the initial surgical approach, positions retractors to protect soft tissues, and attaches the limb to a fixed holding device. Post-final calibration, the robotic arm is initiated and performs the femoral and tibial bony resections independently. Once activated, the surgeon maintains control of the robot via the emergency manual override button. With their system, the robot is doing the bulk of the dirty work. This is in contrast to the semi-active Mako system, where the surgeon guides the robot and haptic feedback is used to ensure adherence to the surgical plan, and the surgeon-controlled system used by the ROSA robot. Sidebar. The active nature of the Monogram robot means that it also is possible to perform surgery remotely without the surgeon being present in the operating room.
Too, when I watch this, I'm gonna go ahead and
So guys, just a pinch me moment. Doug is controlling a robot 2,000 miles away in real time.
Which opens the door for patients in remote locations.
Incredible pictures today from actress Ashley Judd after sustaining what she calls catastrophic injuries while in the Congo after she shattered her leg in a rainforest.
Or in locations where there is no orthopedic surgeon present.
In a rainforest.
To have surgery performed under the guidance of an experienced surgeon who is guiding the robot remotely with the assistance of a surgical team that is co-located with the patient. With both Mako and ROSA, it requires surgeon skill. The surgeon still has to move the arm around or cut with a saw. But with Monogram, it requires no surgeon skill, which is ultimately the point of robotics. Monogram eloquently demonstrated this fact by putting the surgeon 2,000 miles away while conducting a flawless demo. Finally, the Monogram robot is also designed to be more user-friendly and easier to operate than other surgical robots. This is achieved through the use of an intuitive touchscreen interface that allows surgeons to easily navigate the robot's functions and adjust its movements in real time. And this foot pedal that drives the robot is a completely new concept. How else would a surgeon be able to precisely control the robot from over 2,000 miles away? It's not often you see a surgeon looking so relaxed during surgery.
Well, you can see, so that's real time.
So you can see the foot pedal there, so the surgeon can see.
The system is also less finicky to use, with less capture points required for registration in the system, making the whole process quicker. They are one of the first robot companies to integrate augmented reality into surgical workflows to speed things up. They can register the bone in 40 seconds and only 24 total points versus 80 points for the Mako. That means less than 6 minutes total for registration and cutting, compared to over 23 minutes for the Mako system. They use machine learning to generate the case file for efficiency and to minimize user error. That's why I am proud to partner with this video's sponsor, Monogram Orthopedics. Monogram will be listing on NASDAQ later this month under the ticker symbol MGRM. With FDA approval in hand and over 20 patent applications already filed, Monogram is well positioned to bring their product to market. And with a potential market of over $19 billion and over 1.7 million knee replacements implanted annually,
now that's a lot of damage!
Monogram will be the only company on the market that is providing 3D printed, patient-specific implants inserted with active sagittal robotics. So if you think that this is as good an idea as I do, then now would be the time to invest in Monogram Orthopedics before they go public. This will be your last chance. So go to www.monogramorthopedics.com now to invest today. But as a future shareholder, I am biased. With Mako controlling over 90+% of the market share, they are the benchmark for success, but they are unable to offer remote surgery because they are completely reliant on the robot. But to tell you the truth, I'm actually a little torn. While I think that this is a fantastic idea and my brain wants to invest in Monogram, my heart is just a little bit sad about how good this technology is. After spending the better part of my adult life training for and then providing joint replacements for those in need, I can't help but wonder, is this the beginning of the end for me as a joint replacement surgeon?
You're goddamn right. These people from the future are taking all the work away from us decent present-day Americans.
Will there come a time where my hands are not required for this surgery at all? As this and other medical technologies mature, will there come a time when I and other surgeons become obsolete? What do you think? Disclosure. This is a paid advertisement for Monogram Orthopedics Regulation A+ offering. Learn more at invest.monogramorthopedics.com/disclosures. If you enjoyed this breakdown of medical technology, be sure to check out my video about the technology that might allow quadriplegics to walk again one day and subscribe to the channel. If you didn't like the video, be sure to let me know why in the comment section down below. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where the M-Boss sees one, does one, and then teaches one.